Hello and welcome to the Bridges Curriculum Faculty Development Program on Value-Based Care. I'm George Sawaya from the Department of Obstetrics, Gynecology, and Reproductive Sciences at UCSF and from the UCSF Center for Healthcare Value. Value-based care is one of the 7 core educator skills in the new Bridges curriculum. This module will enable you to explain what is meant by value-based care, to describe the benefits of cost-conscious decision-making for both individual patients and society, and to find resources to learn more about value-based care. Simply put, value-based care balances quality, patient safety, experience, and healthcare costs. In other words, it is best care at lower cost. From a systems point of view, a simplified definition of value might be quality per unit cost, but a more patient-centered definition brings in other elements. From a patient perspective, it means integrating patient safety, experience, and affordability. It is clear that we have a lot of room for improvement in each of these areas. Healthcare in the U.S. has been described as fragmented, inefficient, and wasteful. There are many sources of waste and excess in healthcare, but the largest is due to unnecessary services. Things that we do for patients that do not make them any healthier, and in some situations may make them sicker. Unnecessary services include tests, treatments, or procedures that are not supported by evidence or guidelines. These services account for an estimated $210 billion annually. How common is this problem? According to a survey published in 2011, nearly half of primary care physicians in the U.S. believe patients cared for in their own practices receive too much medical care. Too much medical care may cause harm directly via complications of tests or treatments, or indirectly by generating excess diagnoses or additional treatments, which in turn creates more to do and can lead to mistakes and adverse events. Why should physicians consider costs when making medical decisions? We learn a lot about the 4 tenets of medical ethics, and then we spend a lot of time discussing first do no harm and patient autonomy, but that 4th tenet is social justice. We have a professional responsibility to control our healthcare resources and allocate them judiciously. Physicians receive little or no training on appropriate resource utilization and rarely get feedback on their resource use and its impact on cost of care. Healthcare expenditures are increasing at an unsustainable rate, projected to reach 20% of our gross domestic product, or GDP, by 2020. But one of the most compelling reasons is that it is important to the patient in front of us. In fact, medical bills are a major cause of individuals having to declare bankruptcy in the United States. We as physicians do indeed have a social justice responsibility and should worry about the macroeconomic resource stewardship in our country. But for many frontline physicians, this is not very compelling because none of us went to medical school to treat the GDP. We want to take care of our patients. But it turns out that we can actually take responsibility for the financial safety of our patients as well as their medical safety. For example, we can avoid ordering tests just to be safe or out of habit without consideration for the downstream effects. Value-based healthcare is an integral part of the Bridges curriculum since it is a global imperative in healthcare delivery and medical education. Here is the current plan for how value-based care will be integrated into Bridges. In Year 1, students will learn foundational science regarding healthcare delivery systems, including how the systems do and do not function to create health in the U.S., and what roles physicians can play at the system level to create high-value care. Throughout the remainder of the curriculum, faculty educators will teach ideals and practice patterns that provide the best care for patients by maximizing quality, safety, experience, and affordability. How can faculty help instill the principles of high-value care in trainees? A recent editorial by one of our fellow UCSF faculty members, Group Dhaliwal, put this concept into sharp focus. The next generation of clinicians should be defined by restraint rather than action, and the best way for faculty to teach high-value care is through role modeling. Specifically, we can provide feedback to trainees about our ability to defer practices that are out of sync with evidence, discordant with healthcare stewardship, or in conflict with patient preferences. We can acknowledge discomfort with uncertainty and fear of making a mistake. And finally, we can replace the stock phrase for excessive testing, "this is a teaching hospital," with "this is a teaching hospital," so we are not doing an unindicated test or treatment. A great resource for practicing value-based care is the Choosing Wisely campaign, an initiative of the American Board of Internal Medicine Foundation. The Caring Wisely campaign has signed up more than 70 specialty societies across healthcare to create top 5 lists of things providers and patients should question. Another resource is the book entitled Understanding Value-Based Healthcare, available through Access Medicine. The book provides a streamlined blueprint for practicing and teaching value-based care in the academic setting. Finally, the UCSF Center for Healthcare Value is a tremendous resource. The center supports research and policy, training initiatives such as the Teaching to Choose Wisely campaign, and programs to improve our local practices, such as the Caring Wisely program. Visit the center's website for the most up-to-date information. In conclusion, currently, medical care in the U.S. is characterized by widespread overuse. This leads to countless harms. High-value care balances quality, patient safety, experience, and healthcare costs. In other words, best care at lower cost. Confronting this problem will require large-scale systems changes and the commitment of healthcare professionals. In the Bridges curriculum, faculty should understand the basic definitions of and motivations for value-based care and should commit to role modeling these ideals for our trainees. This completes the module about value-based care in the Bridges curriculum. To learn more about the Bridges curriculum, visit the Bridges website or email us at bridges@ucsf.edu. Thank you.